Welcome and thanks for joining to this series of thematic discussions called From Drug Use Prevention to Social Integration, aimed at sharing useful knowledge, innovative approaches, expert demands, best practices in the field of drug demand reduction. Today, we have 5 great speakers, and we will focus on a very crucial subject, which is social determinants of drug use, the conditions in the environments where people are born, live, learn, work, or age, gender, ethnic group, among other dimensions, affect a wide range of outcomes and risks, such as drug use. My name is Oriol Esculias. I will be co-moderating this session on behalf of the 2 organizers this time, Association Proyecto Hombre and the Global Initiative on Drug Use Prevention, and I'm very honored to do it alongside Giovanna Campero, which is the Chief of the Prevention, Treatment and Rehabilitation Section of UNODC, the United Nations Office on Drugs and Crime. So I want to really express to her my deepest gratitude. The session should last 1 hour and will be recorded for dissemination reasons. You can also use the chat box to pose your questions and remarks, and let's see, we have time left at the end of the session to share them with the speakers. Giovanna, over to you.
Thank you so much, Oriol, and let me take 1 second also to acknowledge and thank Proyecto Hombre and the Global Initiative on Drug Use Prevention for organizing this webinar on an extremely important and interesting topic, and inviting me to have the honor to co-chair with you. It is my great pleasure to introduce to you our first speaker, Dr. Marica Ferri. She is the head of the Health and Social Responses of European Drugs Agency, EUDA. Maybe you remember the old acronym of our colleagues in Lisbon, EMCDDA. Marica is a doctor in public health and has a master's degree in systematic reviewing of evidence and epidemiology. And before joining the agency, she coordinated the Cochrane Drugs and Alcohol Group and oversaw developing evidence-based guidelines for public health at the Public Health Agency of Rome. And with their competence and experience, who better to provide us with an introduction to set the scene for our considerations. Marica, you have the floor.
Thank you very much, Giovanna, and thank you, Oriol, for this invitation and the opportunity to introduce this session. So today we are discussing about the social determinants of drug-related issues. While drugs are widespread, their harms, with very few exceptions, do not fall equally across society. Some groups are far more vulnerable, and this inequality is rooted in the social and economic conditions in which people live. Drug-related problems are what we call wicked problems. They cannot be solved entirely, but we can avoid poor or ineffective responses. To do so, we must understand the role of social determinants. The very notion of determinants is sometimes criticized, as it may suggest a simple causal chain, as if poverty or unemployment directly cause drugs problem. In reality, the relationship is fluid and circular. Social conditions influence drug use, but drug use also reshapes social conditions. For example, unemployment may increase the risk of problematic drug use, while long-term use can reduce employability, reinforcing this cycle. Recognizing this complexity is key if we want to design effective and flexible responses to meet the needs of real-world people and ensure they have opportunities to reach their full potential to positively contribute to the society. Let us put aside semantic debates. What matters today is a pragmatic approach acting urgently on the health and social dimensions of drug problems, because every delay deepens inequality and exclusion. Poverty and inequality intensify drugs problems, Evidence showed that people in deprived neighborhoods may be up to 7 times more likely to die from an overdose compared to those in wealthier areas. Unemployment also adds to the risks. In some regions, a 1% rise in unemployment is linked to about 1/4 or 1% increase in overdose deaths. Despite the scale of the issue, treatment is not always reaching those who need more. Globally, it is estimated that only 1 in 8 people with a drug use disorder receives care. In low and middle income countries, the gap is even larger due to stigma, insufficient health systems, and lack of resources. Even in high income countries, women, migrants, people without a stable habitation, and those in rural areas can face additional barriers. In Europe, young people from families with lower levels of education and socioeconomic status report higher rates of frequent use of cannabis, cocaine, and heroin. People with drug use disorders face higher unemployment, financial hardship, downward social mobility, and housing instability. In short, persistent drug use reduces the chances of completing education, holding a stable job, or building financial security for oneself and one family. Studies show that many overdose deaths are concentrated in deprived urban areas and are linked to opioid use, low education, and unstable housing. Risk factors can exist at individual, family, and community levels, all interacting with the broader social determinants of health. Nevertheless, social determinants go beyond socioeconomic conditions. Broader societal changes also play a role. Rapid technological developments, shifts in the labor market, and migration flows can create new opportunities, but they might also deepen social exclusion. Take, for instance, the growing reliance on virtual networks for daily activities. While they can create new communities and reduce distances, they can also erode traditional face-to-face social capital, leaving people more isolated and less able to rely on the help of a neighbor or a colleague in times of need. Another example is the changing labor market, with more telework, flexible schedules, and diverse roles. On one hand, these changes have created opportunities for better work-life balance. On the other hand, shift work, such as night or rotating schedules, is associated with physical and mental health risks, including obesity, cardiovascular disease, depression, anxiety, and increased substance use. When we discuss social determinants of drug use, we must consider the full picture, the conditions in which people are born, live, learn, work, and age, as well as the dimensions such as gender, ethnicity, and social opportunities. These can all influence vulnerability and resilience. To conclude, addressing drug problems requires us to look beyond the individual and even beyond the health system. It means tackling inequality, strengthening social protection, increasing security, and reducing barriers to treatment, care, and social reintegration measures. If we act today with a deeper understanding of these determinants, we can anticipate tomorrow's challenges more effectively. Thank you.
Thank you very much. Giovanna, do you want to say any? No, it's fine. Okay, thank you very much, Marika, not only for what you said, but for you being here also on behalf of the European Union Drugs Agency, which means a lot. We can see that there are many attendees, many participants, so we appreciate that very much from many countries. I cannot read them all, but from all regions, all continents. So thank you very much. And now I'm going to introduce our second speaker, Dr. Pablo Kurlander. He will speak about the cycle of poverty by presenting the story, very shortly, of a boy born in one of the Brazilia's favelas, slums in Brazil. Pablo Kurlander is a psychologist, master and doctorate in public health and currently director of Eureka Educando Institute, program coordinator of the Postgraduate Studies in Addictions, lecturer of the Psychology Department, and coordinator of the NIAT, that means Inspirar Center for Care, Research, and Studies on Alcohol and Other Drugs in Inspirar College, Brazil. I'll give you the floor, Pablo, very committed professional, and over to you.
Thank you, Oriol. Thank you for the invitation to be participating in this really great event on this important issue. And you said I will present Caio's story. Let me share the slides. So as I will present his story, I will present some images I created to it. It's a fictional story, but unfortunately it's not so fictional, as you will see. And considering everything that Marika presented, these real interesting points about the social determinants, I will share this story, which will present, will show these determinants in real life. So Caio, let me start here, sorry. He is Caio. Caio is a 19-year-old black youth who lived his whole life in the favelas of Complexo do Alemão in Rio de Janeiro. He dreamed of becoming a lawyer, but couldn't finish school because he had to help his mother support the household and his 3 younger siblings after his father left when he was 12. At 17, his mother lost her job and the burden of the family fell on his shoulders. The salary he earned as a construction assistant wasn't enough to sustain them. He wanted a different future for his siblings. He had already given up on his dream of becoming a lawyer, but not on the dream of giving his brothers and sisters the chance to study. He always knew the small dealers in the neighborhood under planes, that is a slang for young runners who deliver drugs in the favelas, but he always wanted to make his mother proud, so he avoided the offers of easy money that came his way. When he lost his job, the situation at home became critical. Soon there was no gas, no food, and bills piled up. He didn't want to tell his siblings what was happening and swore to his mother he would find a way to fix it. Very saddened, he went to his old friends and said he was willing to become a plane to earn money for his family. So very reluctantly, he began carrying small amounts for people who came into the neighborhood, and soon he gained the trust of the brothers. Things at home improved. There was food, gas, and bills were paid. His siblings only noticed that Caio's work shifts seemed longer, and sometimes he had to take night shifts. One day, the boss asked him to deliver a larger quantity to a wealthy neighborhood. The client was important and needed fast. Caio didn't even have time to think. Soon he was on a motorcycle with half of a kilo of cocaine. This run would bring good money, enough to buy school supplies for his siblings, and that comforted him. Leaving the neighborhood, just under the first overpass, he saw a police checkpoint. Panic struck. He had thought this could happen, but seeing it for real was different. With adrenaline at its peak, he swore sharply, shot before reaching the police, and soon a patrol car and a motorcycle were chasing him. He had only ever heard gunshots from inside his house, praying that no stray bullet could slip through his window and hit a loved one. But now, these were no stray bullets. He was the target. Soon he felt his leg burning and lost balance on the motorcycle. His time had come, he thought. Days later, guards took him out of the station in handcuffs to the courthouse, where a judge would decide his fate. The prosecutor read the charges against the criminal: drug trafficking, possession of weapons, attempted escape on a stolen motorcycle. Circumstances young black man, unemployed, resident of the favela, incomplete elementary education. In court, they should look at Caio with the coldness of someone who had already seen hundreds of identical faces. The public defender tried to argue, Your Honor, this is a first-time offender without a prior record who acted out of extreme need. Prison won't rehabilitate him. It will only deepen his exclusion. The prosecutor countered with numbers. Trafficking is a serious crime. Society demands punishment. If we make exceptions, we will be encouraging crime. Caio said nothing. He knew his voice carried no weight there. The verdict came quickly. 8 years in a closed regime prison. His mother wept on the back bench. His siblings weren't present. It was a school day, and Caio had asked them not to miss class. In the prison, the stories repeat themselves with different names. Young men like him, black, poor, dreams cut short by a social machine that doesn't forgive those born outside the civilized zones. There, trafficking wasn't just a choice. It was a parallel structure that offered what the state denied: income, respect, protection. These stories weren't exceptions. They were the portrait of a country where the social determinants of health and criminality intertwined: poverty, low education, unemployment, absence of effective public policies, structural racism, institutional violence. Caio was the product of all this, but not by choice, but by survival. A few months after being in his cell, a prison guard broke his law books. You wanted to be a lawyer, right? Start here. Caio devoured the text even without understanding everything. He felt that somehow he could still fight. Caio's story is not unique, and almost always ends much worse. It's the story of thousands of young people living on the margins of lack of opportunity. In the state, were more present and the society a little failing. Maybe stories as Caio's could end better. Fighting trafficking requires more than repression. It requires investment in education, health, culture, sport, job creation, combating racism, strengthening families. It requires seeing Caio not as a criminal, but as a real citizen. Thank you for the time.
Well, thanks a lot, Pablo. This was also to pay homage to so many kids that must live in a very challenging context today, still today, in many world regions, many world countries. Thank you very much, Pablo. Giovanna.
Thank you, Oriol. Thank you so much, Pablo. Also, and from the example of Pablo, who brought to life in maybe fictional but grounded in reality story all of the issues that Marika had already raised before. Let's move to think about something more systemic, and it's my pleasure to introduce you, Kristina Sperkova, who is the international president of Movendi International and the chairperson of Movendi Slovakia. She has a master's degree in psychology from Comenius University in Bratislava and has been active in the field of prevention for almost 25 years. She works the whole spectrum in prevention approaches, from peer programs in the youth to population-wide approaches currently. She is a member of a working group advising the Director General of WHO on prevention of non-communicable diseases, and is also a Planet Youth Ambassador. And she's here to tell us and speak more about a very particular kind of social determinant, which is the influence of the alcohol industry, which will bring to life a different way of looking at this important issue. Kristina, the floor is yours.
Thank you, Joanna, for a very nice and long introduction. I will then speak about something because thank you, Pablo, for this story. And I have been really thinking about it, that you are talking about substances, drugs that are illegal, and how many people are really part of trafficking them, and it's in the darkness, it's happening behind the scenes, even though we all know that it's happening. And I'm going to talk about a legal drug, and also about something that is happening in front of our eyes. So I'm going to share with you now what the alcohol industry is doing. And with that, I would also like to thank the organizers that you have also included the topic of alcohol in this, and alcohol industry specifically, as you said, Giovanna, one of the social determinants of health, a commercial determinant. So when it comes to alcohol industry, what they do is that they are really shaping our environments, our minds, our understanding. They are shaping policy, politics, but also really the broad environments where we are living. Marketing, which is really, everyone is familiar with it, and it's the promotion with this happening in front of our eyes. Costs a lot, or like they spend lots of money on this. So here we can see just the biggest alcohol producers in 1 year. They spent more than $17 billion US dollars on shaping our minds and on shaping our understanding of this substance. They are not, of course, only shaping the environment, but also the policy space. And you can see how many entry points the alcohol industry is using. They are not working only with the health ministry, one would think. They're not only with finance ministry, but they have law firms, and they have PR groups and other lobby groups that are really interfering. And this is just like a small snapshot, I would say, of the entry points that there are for alcohol industry on the European Union level. So this is happening. And at the same time, alcohol industry has a huge conflict of interest. For example, in Germany, if you look at this slide, 50% of the revenue of the alcohol industry comes from high-risk alcohol use. So they want people to use lots of alcohol to earn money. So they have no interest to reduce alcohol consumption. And I'm talking about it because I will come a little bit later to some examples how they pretend that they do it. Here you can also see that the alcohol industry is really taking money out of society. So here we have how much money comes into different budgets of different countries from alcohol taxes. And then you can see how much is spent on the harm the governments need to pay. It's not the industry that pays this. We cannot compare these numbers. This is important to say, because different countries count the harms and calculate the harms differently. But you can look at it within countries. So Australia, 10 times more. What comes from the alcohol industry, from the taxes, and how much is spent on the harm. And if you are here from a country that is in this chart, I hope it helps you to just understand the big difference. And Movement International, we are a huge global movement. We have members in more than 70 countries. And what is it that we are doing? We are looking at alcohol industry practices. We are identifying different myths and lies that the industry is spreading. We are monitoring and documenting it. We are also exposing it, and then also helping to counteract the different practices. So what we have done in the latest year, we have summarized more than 100 cases of alcohol industry misconduct, misbehavior in 2024 only. So there were more than 100 cases that come out in the report. We call it From Sports to Screens. And I thought I will just mention some of the really appalling examples. And one that really, it hurts me every time I think about it, is that, for example, alcohol industry is it's harvesting data. They are following the behavior, our behavior in social media. And here in this specific case, they have been promoting alcohol to people who have been searching for help. for help to get over the addiction or for help with alcohol problem. So they were searching for help, and the alcohol industry has been really targeting them and promoting them more alcohol. It's incredibly dangerous activity that they are doing, and it for sure costs lives. They are also, I would say that, like, they are harvesting data. They are targeting young people all the time. There are different programs that they are participating in, and but not only in digital space. And I think this would be one of the last things that I would like to say. For example, alcohol industry is trying to promote its image as a partner of the government in helping in prevention. So they have different prevention programs. For example, also in Spain, where the alcohol industry, through their front group, cooperated with the Ministry of Education in a program called Not a Drop to Minors. And we know from the analysis of like academic analysis of these programs that these programs have no, they do not help anything. What they do is that they really promote personal responsibility for all the harm that comes from alcohol. They narrow the harm. They only make it alcohol abuse, for example, but all the other harm, all the 200 diseases that are connected with alcohol, they are completely ignored in this kind of programs. And they also, again, blame it on peer pressure, poor choices, and they definitely do not teach and help young people, for example, to resist marketing and all the targeting that the industry is doing. And not only that, but they also really normalize the use. So they, through these programs, actually establish in young people's minds that it's very normal to use alcohol, and you have to do it in this and this and this way. So these are just like really, we call it dubious practices of alcohol industry. There is no nicer word for that. And they are like, marketing is one, then there is lobbying, promoting, sabotaging different laws, manipulating and decepting. And the last thing that I would like to add to this is that it's not only alcohol industry, tobacco and alcohol industry, they are big bodies. And what we can also see now is that the marijuana industry is having similar practices, and they are sharing knowledge between each other. So they learn from each other, and they are using the same practices. So it's very good to learn very early from the practices of tobacco and alcohol industry, and also from the civil society that has been already counteracting and facing this. So we need to denormalize the alcohol industry. It's very important that we do that. We need to support those who are already doing it, protect from the interference that's for governments, from the interference and policy interference. And it's important that we do not buy into the narratives of the alcohol industry. Thank you very much for your attention.
Thanks a lot. Giovanna, do you want to say anything?
No? Oh, you go ahead, my dear.
Thanks a lot. I can say that Christina is challenging and shaking consciousness the whole year at all levels, and trying to explain how commercials, for instance, on alcohol, are really having an influence on the health of people, particularly the youngest. Thank you very much, Christina. Then we're gonna move to the next one. It's my turn. Wendy Munoz from United States. It's a pleasure to introduce her, Master of Social Work and Bachelor of Arts at Arizona State University, while currently employed in psychological support in crisis intervention with local fire and police departments. She has also worked in residential behavioral health treatment, detox and addictions programs, crisis and urgent psychiatric centers, and in rehabilitation and social reentry agencies. In research, she has specialized in marginalized groups and people of color communities. Above all, she has started her master's internship in my department, Proyecto Hombre, so she's my teammate, which makes me feel very, very happy. Wendy, you have your 6-7 minutes.
Hello. It's a pleasure to be here today. I will be discussing substance use in Indigenous peoples and ethnic minorities and the factors that contribute to the realities, the myths, and these things we call social determinants. So let's start with the Roma people in Europe. According to a publication by the SRAP Project, Addiction Prevention within Roma and Sinti communities in 2013, there were about 4 to 8 million Roma people living in the EU, but this is an estimate as they are not always accounted for in the national census. And the Roma people in Europe tend to live in poor housing conditions, segregated with overcrowding and a lack of access to good sanitation. They are at high risk for health problems, fire and domestic accidents. There is a prevalence of low employment and education rates. The life expectancy of these individuals is about 8 to 15 years shorter than the average population. This is, of course, exacerbated by a lack of access to healthcare. From the limited research on addiction found at the time, Roma youth were found to be at an increased risk of developing heavy and dependent use after experimenting with substances. And they showed an early initiation to tobacco and alcohol use. Now, it is noted that ethnicity alone does not influence drug use, but contextual factors such as socioeconomic status play a large role. As we will see with other ethnicities, acculturation, trauma, and perceived discrimination play important parts as well. Ultimately, the SRAP research found that consumption did not differ much between Roma youths and the general population. They were, however, at a higher risk because of the factors discussed. The Kurds are another group that is hard to get accurate estimates of due to host countries registering them as Iranian, Iraqi, Turkish, or Syrian citizens. They are in what Khalid Kayati calls a statistical invisibility. A study in Finland on substance use among Russian migrants and Kurdish refugees revealed that among Kurdish refugees, potentially traumatizing experiences were correlated with binge drinking, and perceived discrimination correlated with lifetime cannabis use. This highlights the importance of discrimination as a risk factor for substance use. The same researchers also found the prevalence of occasional or frequent binge drinking among the male Kurdish migrants was only 27% compared to 87% for Finnish males. Similarly, 6% of Kurdish migrant women compared to 72% of Finnish women engaged in binge drinking. So in this case, the ethnic migrant minority showed much lower levels of alcohol use compared to the main population. This could be an example of what is known as the healthy immigrant effect, which occurs when the immigrant population is healthier than the main population. However, this gap reduces in some time in the new environment. In fact, McCabe et al. Studied the effects of acculturation on substance use in Latinx immigrants in the United States and found a positive correlation between culturally based stressors and alcohol and drug use. They also noted Latinx immigrants exposed to American activities have greater alcohol and drug use. So in other words, the longer this population was in the host country, their chances of substance use increased. According to SAMHSA's 2023 National Survey on Drug Use and Health, less Hispanic individuals aged 12 and older used drugs or were diagnosed with a substance use disorder over the past year than their white American counterparts. Native Americans aged 12 plus, however, had the highest prevalence of drug use and substance use disorder in the past year. So there's been a longstanding belief that Native Americans have a biological vulnerability to alcohol. This is known as the firewater myth. The myth may be fueled by a complex and traumatic history with alcohol, which was used as a means of control during colonization. A study by Ehlers did find alcohol use to be hereditary as much as any other population, but did not find specific genetic vulnerabilities within Native Americans. Instead, environmental risk factors such as trauma and poor access to services were considered the most likely culprits for placing them at high risk. On a similar vein, the prevalence of substance use in Black Americans was near that of white Americans for those same categories. Even further, of young people aged 12 to 20, white individuals were more likely than any other minority to have engaged in binge drinking in the past month. So, how are minorities at high risk here? Well, the general approach to drug use tends to be a punitive one that lands people in jail and prisons for engaging in their addiction. According to the Sentencing Project, Black and brown people are overrepresented in US prisons, with Black Americans being imprisoned at a rate 5 times greater than white Americans. And what happens after incarceration? You become a walking stigma. A criminal record follows you the rest of your life. You might be liable for fines and fees, while employment opportunities are decreased because of your background. This can lead to lower paying jobs while you struggle accessing adequate housing. You end up living in more impoverished areas, many times with increased crime and less access to adequate healthcare and food. The systemic barriers multiply and transfer down, creating a cyclical pattern for further generations with slim chances of moving up in socioeconomic status. Mobility is further restricted by difficulties in emigrating due to criminal background and economic factors. So how do we begin to fix these contextual factors that are increasing risk? This brings me to Australia. According to the Aboriginal and Torres Strait Islander Health Performance Framework, cannabis and meth were the most common drugs in Indigenous prison detainees. Meth was involved in 25% of drug-related hospitalizations, including suicidal ideation. Due to the large role that drugs play in criminal justice system involvement in the Aboriginal community, there exists an alternative form of sentencing that takes into account their culture by involving elders, offenders' families, and victims if they so choose. This is called circle sentencing. And between 2008 and 2018, of offenders participating in circle sentencing, 52% were less likely to be incarcerated and 9.6% less likely to reoffend. Indigenous communities suffer from the traumatic events of the past and present day oppressive systems. This historical trauma can place them at a high risk for substance use and suicide. Circle sentencing appears to be a culturally competent attempt at mitigating the effects of intergenerational trauma caused from colonialism. In summation, when working with Indigenous and ethnic minorities, it is important to be mindful of potential trauma, be informed of the systems that impact them, and aware of whatever strengths and protective factors their culture provides. Thank you.
Thank you, Wendy. It's a wonderful, we've gone back to look at systemics, but we are ending on a positive note with some possible solution. And I think that that is a good segue in our next speaker that I would like to introduce is Dr. David Patton from the University of Derby in United Kingdom. He's an associate professor and his work focuses on drug and alcohol recovery, resistance from crime, and challenging epistemic injustice by amplifying the voices of those with lived experience. And he combines academic research with community-led projects that generate new ways of knowing and doing. He's also the founder of New Central Media, the Decolonial Publishing Initiative. And I think it's wonderful to have you with us, David, and to speak about the power of communities, the way forward. So give us a path out of this mess, but more seriously, we're very, very happy to have you here. Thank you for being here. The floor is yours.
Thank you so much, and thank you for that lovely introduction, and just congratulations to the organizers today. Seeing over 250 people from all over the world is no small feat, so congratulations. And it's been great just listening to my fellow speakers. Thank you so much for your powerful presentations. I certainly learned a lot and have been taking notes throughout, I'm sure you've seen. So thank you so much. So today, no small task, I want to talk about the power of communities. And really, I kind of want to offer, I guess, a bit of hopeful kind of way through all of the kind of the problems and the inequalities and the lack and all of the other issues that have been raised by my fellow speakers. And it's not to diminish the significance of those or the need to kind of condemn those and, kind of continue to document those and advocate against those kind of things that are unfair and unjust. So today I'm going to talk about 3 C's, and I'll outline them briefly, and I will then give you kind of a bit of a case study of a community example that I think embodies those 3 C's. So I want to talk to you about, for me, I've published work around lived experience really exposes, drawing on the work of Ruth Levitas, both critique, compensation, and a call to kind of creating something new. And so what you've really heard from the fellow speakers is a critique of what is. Okay, when we look at the present, whether it's the systems, the structures, the resources that are available, the way in which we live, the way in which we seek to support people, there's a lack, there's a gap between what is needed and what is provided, the way in which people need to be treated and the way in which they are treated. And I think so often as academics, we love to just stop there. So we do research and all we do is critique. And, we've read report after report that gives all of these damning statistics. But then you go, but so what? What's going to change? And so it's really important that we move on to the next two C's that I'm going to focus on in the remainder of my talk, which is compensation and call to the world anew. And so what happens when we acknowledge that there is a lack, that the present doesn't meet sufficiently justice and equality and so on and so forth, that actually the imaginations of the people who are impacted the most, people who get labeled as weak and marginalized and vulnerable, they become the solutions to the very issues that we all will do is talk about the critique of. So when systems and structures kind of exclude, the communities and the people invent. They have to. Their survival depends upon it. So we look to the LGBTQ plus community, we look to the global majority, we look to people who were in addiction, who are now in recovery, who get sidelined as marginal, who come up with the creative solutions to the stopgaps, to the systems, and to the structures. And so that would be the compensation, that they create these food aid initiatives, or they create the mutual aid groups, and so on and so forth. Whatever is needed, they create the blueprints of resilience and imagination needed for not just survival, but actually, I would argue, also flourishing. So the final C then, so we've done critique and talked about compensation, is the call to the world anew. And if we kind of would elevate those lived experience voices, rather than relying upon the politicians, the policymakers, the academics, the people in positions of power to come up with the solutions, if we give the people with the lived experience the credit and the authority that they deserve, what they're inviting us to is to see the world anew. They've invented those new ways of being and seeing, of relating and doing, that if we would just open ourselves to them, we would then be able to enter into this kind of new world order, if you like. So I guess what I want to do now is just kind of land this with a case study, and I'm going to use the recovery community as the example. So oftentimes the academics kind of use research evidence, the hard data, and they look at an individual, and they will look back at that individual's life history, and they'll say, okay, they grew up in the wrong part of the neighborhood. They come from a dysfunctional family. At this age, there was some form of abuse. They had poor education, so on and so forth. And what that does is it narrows the lens to look at individual factors, which, yes, they are important, but we stop addressing the macro factors around coloniality, around capitalism and patriarchy, and all of the harmful and dysfunctional patterns of life and living and work and relating that then creates. So people on the margins who then face the brunt of these structures and systems do end up in our prison systems, in our justice systems, and in drug addiction kind of statistics. That's what we've heard from lots of the presentations today. So what they then have to then face initially for survival is in the lack of empathetic, supportive care systems. What will I do to get me out of this kind of hellhole of addiction, homelessness, joblessness, so on and so forth, extreme poverty, no hope whatsoever? What will I do? And so the community becomes the solution. The majority of people don't recover through formal, centrally funded treatment providers. Research is very clear that the majority of people who overcome addiction do so through forms of community pathways. Now, why is that? And we need to change the gaze to look at the community and these informal pathways that seem to be working. And so as I've mapped this out from a research point of view, I've explored the culture, what I call the culture of recovery. And when you look at this culture, when you look at their norms, the values and the beliefs of this community, what you see is the complete opposite to the blueprints for modern day living. So you see connection and community at the heart of the culture, and not just buzzwords. Everyone in the workplace, oh yes, my team's like a family, we have a great team. It's like, well, maybe it's just my workplace then. It's a little bit off. These are genuinely authentic terms that have meaning and substance behind them. They're also a very collaborative kind of culture and community. So they kind of work together and they support one another. Moreover, if they're kind of in need of help, they're so authentic with one another, they don't do the fake self, that actually the help is provided before they even ask for it. So there's none of this individualism or isolation or competition that so often dominates our relations in the community, in the workplace, so on and so forth. So what these communities do when they come together as a collective is they create what Foucault would call a heterotopia. Now, a heterotopia is just another word for an alternative space. So if you think about modern living, we tend to operate as individuals. We like to fend for ourselves, don't need anybody's help. I'm doing okay, thank you, and so my children. And we cultivate this false self. So when the community comes together of recovery that embodies this alternative way of living, they create this alternative space whereby this healing can occur. So we have this accumulation of recovery capital occurring. So personal capital, social capital, and community capital is generated by the community indigenously, informally. We don't need external funding to cultivate these forms of capital. The people within the community, because of the norms, values, and beliefs of that community, self-generate it. And what happens is we see that then kind of build up to such an amount that it then spills over, it ripples over, almost like a flywheel effect. Jim Collins talks about the flywheel in kind of businesses. And what we see then is that this goodness that's generated by the community spills over, not just for those people who've been in addiction, not just those people who are using drugs, but actually to their friends, to their family members, to their neighbors, to their work colleagues, and also to their local community, because they're challenging the blueprints and the norms for how we should be living. And they offer a very tangible alternative. So for me, I guess, as I kind of just finish, because I'm aware of time, as you can tell, I can probably talk for another 2 hours.
One minute. You have one more minute.
Thank you. I'm only scratching the very surface. So for me, the question really is what would happen if we treated these community-led alternatives not as marginal, but as central? And actually, we need to stop getting so frustrated with trying to change the central system and maybe change the gaze elsewhere. So let's move. My call really is to move beyond critique alone and let us see what the compensatory worlds that these marginalized communities are already making, and how can we support them? How can we elevate them? How can we get behind them so that these new models of being and relating and doing and knowing are not the exception, but become the norm? So thank you so much for listening today, and I look forward to taking any questions. I put my contact details in the chat, so if you think of a question later, do contact. Thank you so much, everybody.
Well, thank you so much, David. I have a couple of 3 questions raised in the chat box. There are many comments, but there's one that I could share it with Giovanna, Marika, or yourself, or Wendy, or it's about research on ethnic minorities or people of color, etc. If most of this research is done by white people, or from the West, what are your thoughts on that? If that's like this, or there's an increasing research coming from non-Western regions, or just a comment on that?
Yes. So I've just co-produced some research with the global majority in England. So we don't use the term ethnic minority. We use the term global majority to more accurately kind of reference.
You said global
majority. Yeah. So So the white Western world have called them ethnic minorities, which is again the power and the hierarchy introduced in the language, which is very deliberate. And so we now use the term the global majority to refer to kind of people of color. And yeah, so so for me, the answer is that actually the research base should be co-produced as a minimum. So, you know, as myself as a white middle-aged male academic who's a large part of the problem, I never do research from my gaze, from my vantage point. As a minimum, it would be co-produced. Co-produced as a minimum, and it would have lived experience at the heart of the epistemology. So if we're creating knowledge, it's got to be generated from that lived experience community. And so with this particular piece of research, we went out.
Also, no, sorry. Please.
Yeah.
You can continue.
We went out to the global majority in communities across England, and their voices were centered in the research. So it wasn't my framework that was kind of at the center of the narrative of the research. It was generated from within the communities, and that was what was communicated. And we just need to acknowledge our own positionality as a final point. You know, not all white Western research is a problem, but we do need to acknowledge the limitations and our potential pollutants in the work that we do. Yeah.
Food for thoughts. Marika Ferri, you also wanted to comment.
No, just because I like when David says not only focus on the critics. So there are positive signs. For example, in the European Union, we have the forum of the civil society organizations, and in our new mandate, there is an obligation to collaborate with the civil society organizations, including people with living and lived experience. And also at the European agency, we have a contract with a number of editors. Among the many objectives, there is also ways to facilitate access to publication to people from, for example, non-English speaking groups, but also really so-called ethnic minority. I have some issues with this minority because quite often it's not the case. But anyway.
I am learning a lot today. I am learning a lot today from you.
not usually highly represented, let's say. So yes, there is some awareness, and we are slowly going more in that direction.
Great. There are several comments on how to contact all of you. So to keep on discussing, my suggestion is that no worries, that anyone participating will receive the recording of the session, and I will previously ask the speakers if they want to share the email address, whatever. So we will revert to all you. There's also a question on alcohol, but goes beyond social media, the relationship between alcohol, commercials, and social media. How, if you want to make a comment, the question is longer, but this is the topic.
If it's for me, Oriol, I didn't see the question. So if you could please repeat it.
So the question is about if you can explain more on how the alcohol in industry is really penetrating people through social media.
This is a great question. So alcohol industry is really getting the data, and now with artificial intelligence, they can really even individualize how they target us. So they really, as you can see it also with other products, but as soon as you click on a shoe that you like, then you will get lots of commercials on different shoes and everything, and your world becomes huge when it comes to the shoe world all of a sudden. And this happens also with alcohol. So they really have this advantage of the data that they can really harvest from social media. And then they either directly, or they of course pay different influencers and do the traditional promotion through their own pages.
Great. Anyone else want to say a word on alcohol? No. Okay. There are many comments, but maybe I would ask you if you want to say anything before we go to the closing. We still have one more minute. Giovanna, do you want to say a word? Christina? Yes.
Just want to say
Yeah.
thanks, and let's do some more. But Christina has better ideas, so let's hear from Christina.
Well, thank you for now. I feel
Marika
lots
also.
of pressure. No, I really wanted to talk about the lived experiences. I'm happy that it has been taken up. And what we are really discussing a lot in our organization, and this is what David also talked about, it's actually the communities. When I talked about members in 70 countries, I actually talked about organizations and the communities in many countries. And it's important that we don't limit the lived experience only to the experience of drug use or like the use of the substance, because there are families who witness it. We are, for example, all experiencing alcohol norm as a very strong norm. Marijuana norm is maybe coming. So I think that this is also lived experience. The industry targeting, that's lived experience that we really carry with ourselves. So I would like to contribute with that. And thank you very much for the whole event.
Likewise. Marika, you want to say a word?
Yes, just a reflection. I loved all these presentations. I'm very grateful for this invitation. I was reflecting on the fact that democracy and living peacefully together requires an effort, and the effort is to give everyone the possibility of reaching their full potential. And if we don't do that, we will be all harmed. It's a problem for all of us. There is no their rights, my rights, their poorness, we are really all increasingly more all in the same boat, and we really need to take care of everybody. I adored Pablo's story. It is really moving, and I think how many talents we just lost, putting people in prison, connecting them with the organized crime through the prisons, and losing opportunities for new ideas and benefit for the complete society.
Excellent. Giovanna, thanks, Marika. Many thanks. Giovanna?
I thought you were going to close. I mean, for me, this has been a wonderful opportunity on two accounts. One is to have, of course, an introduction to the social determinants of health, and of drug use, and of commercial determinants of health and drug use. But you know, for me at least, were concepts to which I'd been exposed already. What has been wonderful, and I thank you, Oriol, and the organizers and all my fellow co-panelists, are the example bringing these issues and concepts to life. So the story of Pablo, the very concrete example of Christina on how things work in an industry that doesn't have health as their priority, because their priority is profit. And of course, the possibilities and what is happening with populations that are more marginalized for different reasons, including could be ethnicity. And I really appreciated the examples of Wendy that put some very few points, but very pointedly put us all right into what is really going on and how to see things differently, on which, of course, David built with an opening up of possible future action for us all to do something about this, and not continue to focus, which is necessary, on the research that sometimes is a bit discouraging, because we find more and more problems, but also to create cycles of action research that really document solutions and spread health in the good sense of the word. So not physical health, but really the well-being of individuals and communities. So thank you again, Oriol and dear colleagues. And I hope that we continue this kind of conversations, looking at these issues from different angles, so that we can all learn from each other how to improve.
Thank you very much, Giovanna, for being here, for your support. Monica Ferri, David Patton, Cristina Sperkova, Wendy Muñoz, Pablo Kurlander. All of you for participating. There were more than 250 people sometimes, so a lot of people. Thank you very much. We'll keep in touch. I can only announce the next thematic discussion for November 25th, similar time. And you guess the topic. Do you guess? So we have chosen securing funding for drug use or for drug demand reduction, the issue of funding, which is very challenging for almost everyone. So this will be the next one, and you will be receiving information, the program, and how to register very soon. Thank you so much, and we just close the session. And to the next one. Goodbye, everyone.
Thank you, everybody.
Thank you, Oriol, and thank you, everybody.
Yeah, bye-bye.